Hello and welcome to week one. I'm so excited to have you here. I'm Morgan Yost. Today we're going to start by understanding the basics. This is going to lay the framework for the entire course and kind of helping us to understand what is the problem and then how ultimately are we going to treat it. So the outline for week one is broken up into two modules. We're basically going to talk about LPR, which stands for laryngopharyngeal reflux, and we're going to tackle it with the who, what, where, when, how mantra. And then module two is going to be all about the ACLM, which is the American College of Lifestyle Medicine. As you may know from introductory videos, this is going to be the framework for the course and really laying the groundwork for this holistic approach in helping to treat acid reflux and particularly LPR. I'm super excited to have you. Let's get started. Hi, it's Morgan Yost. Let's get started with week one, lesson one. And I want to kind of tackle these first few modules in sort of a foundational education of what it is that we're going through and what's ultimately, I think, led a lot of people to this course. So the first thing I want to talk about is LPR. That's going to be an acronym that we talk a lot about. And I want to tackle this in a very traditional way of who, what, where, when, how. What is going on here and how are we going to get you better? So let's start with laryngopharyngeal reflux. What is LPR? Well, I like to call LPR silent reflux. For a lot of patients, it's a condition that they may not necessarily know much about, and it's often been coined silent reflux because many people don't know it's even happening. So let's start with who gets it. Well, unfortunately, millions of people suffer with LPR. It is a condition that is so prominent in our society, but unfortunately, it's often misdiagnosed and not something that many people have heard about. The number one thing that most people report is a condition called globus sensation. And what I like to discuss is globus sensation is basically that feeling like there's something stuck in the back of the throat. So let's talk a little bit about what it is. Well, first I want to compare it with something that you may have already heard about called GERD. GERD stands for gastroesophageal reflux disease, and this is more traditional heartburn. This is something that most people are aware of, and a condition that oftentimes they feel like, they're having significant heartburn. So LPR we'll just call silent reflux, and GERD we'll call traditional heartburn. So really, what is it? Well, it's kind of like a cousin to GERD, in my opinion. LPR is like the little brother. So let's talk about each of those. GERD is the big bad cousin. GERD is basically burning or irritation of the esophageal lining. Acid comes up from the stomach, it pools in the esophagus and causes significant amounts of destruction of the lining of the esophagus, leading to traditional heartburn. What I often tell patients is the acid is there for long periods of time, enough to actually cause, changes to the lining, what we call mucosal injury. And this is that classic sternum, retrosternum, kind of behind the chest bone there. That's the pain that most people will get with GERD. So LPR, on the other hand, is kind of like the little brother or the sneaky cousin. Again, it's coined silent reflux because most patients don't even know it's happening. So here's sort of what the pathophysiology of sort of when this happens. For most people, it happens anytime. It can happen during the day, that little burp, after drinking something, that feeling like something kind of came up, clearing your throat. These are all little micro aspirations or micro bursts of acid reflux. But what's frustrating about this is that oftentimes it's happening at night when patients are asleep, and therefore they don't even know it. They wake up in the morning with this feeling of something stuck in their throat. They have to cough and clear and get all this mucus out. And they wake up saying, well, I wasn't doing anything. I don't know what's happened. Why am I having this? And oftentimes it's because of silent reflux happening at night when they're asleep. So where is this happening? Let's talk a little bit about the anatomy of the throat. Basically, right here at the collarbones, we have a separation between sort of the upper airway and the lower airway. So the larynx, or the voice box, basically sits right here behind a patient's Adam's apple. The lining of that tissue is actually quite delicate. It's covered by a single layer of tissue that basically has little mucus cells that are meant to sort of transfer and trap allergens, dust, bacteria, all of those kinds of things so that they don't actually get all the way down into our lungs. The entire upper aerodigestive tract is covered with this stuff, basically from the nose and until the larynx itself. It changes a little bit once you head into the lungs, and it definitely changes once you head into the esophagus. So what I like to point out to patients is the larynx and the upper airway tissues were never really meant to handle the irritation and the damage that acid and other stomach contents causes. So because it's this really delicate, thin layer, its only protection is basically to create some sort of buffer or separation between the injury, the acid, the pepsin, which we'll talk about, and the actual lining of the throat. So the way that it does this is by creating more mucus. As you know, mucus is already naturally produced in our upper aerodigestive tract. We all have mucus that's naturally created day in and day out to help protect us against these different things, like dust, like allergens, like bacteria, like viruses. But the larynx, what it basically does is it creates more of that mucus to try and protect itself against the stomach contents. All right, I'd like to talk a little bit about a condition or a procedure we call flexible laryngoscopy. This is something as an ear, nose, and throat surgeon that I perform almost every single day in the office. What we basically do here is we anesthetize the nose and we pass a small flexible scope through the nose, down the back of the nose, and ultimately into the airway. And we can look at the larynx and the back of the throat, an area we call the pharynx. And again, that's kind of why this is called laryngopharyngeal reflux, laryngo referencing larynx and pharyngeal referencing the pharynx. Anyway, so the upper airway, this is how an ENT actually looks at your upper airway. And many times this is how the diagnosis of LPR or silent reflux is initially made. This is what I do in the office to help look in the patient's airway. And it's one of the most helpful things that we have to diagnose acid reflux and laryngopharyngeal reflux in particular. Okay, so how is this happening? Well, unlike GERD, which we talked about is long episodes of acid basically burning the lining of the esophagus, LPR we think of as basically being small little microbursts, quick little bursts of stomach content. Again, that burp, that clearing your throat, something acid and pepsin coming up into the throat. So acid is pretty common. People know about that. The stomach has hydrochloric acid in it all the time. It helps to digest our food. But what oftentimes gets unappreciated or unrecognized is that there's lots of other digestive enzymes, particularly one called pepsin. Pepsin is inside of our stomach, and it helps to break up certain proteins in the foods that we eat. Those proteins are swallowed down, they are churned, and ultimately come in contact with all these different enzymes, and they're broken down into forms that we can use. Well, pepsin in particular is used to help digest proteins. It's activated when it comes in contact with acid. So this is super important for the throat because when pepsin is microbursted up into the throat in combination with acidic environments, it starts to break down protein. Well, the lining of the upper airway is made up of various protein substances. And so in essence, the acid and the pepsin are digesting our own airway. And that's again why the throat lining produces more mucus, trying to protect itself. All right. So oftentimes, and this is, I think, the most frustrating part, oftentimes patients feel like they're in limbo. They don't even know for sure, do I have this? Do I not? What do I do to treat it? My ear, nose, and throat surgeon or primary care provider don't seem particularly worried about it. Maybe my symptoms are mild. Maybe they fluctuate. So they're kind of left saying, well, is this even a real diagnosis? What's my treatment? What am I going to do about this? And this is probably one of the more frustrating things that happens to me as a provider in helping to educate patients is they often feel like nobody's ever listened to them. They don't feel like they necessarily have a clear path forward. And that's probably the most important thing that I'm hoping to accomplish with these modules is to give patients a chance for hope and a clear treatment plan moving forward. We don't have to be stuck in limbo anymore. Okay, that's the end of the lesson. Stay tuned for more. Welcome back. Week 1, lesson 2. I'm really excited about this one because I really think that it establishes the foundation of how we're actually going to do this. Up to this point, I think we've just been giving theoretical information. What is LPR? Why do you feel the way you feel? A lot of motivation that we can help you. But this is the kind of the framework of why I think this course is different and potentially why it's different than anything else you've received from any other ear, nose, and throat provider you may have seen or anything else on the internet. And the foundation here is what we call the ACLM, the American College of Lifestyle Medicine. Probably not something you've heard of. So what is the ACLM? Well, in short, it's a medical specialty that focuses on therapeutic interventions, but it's important that it's through lifestyle changes. So basically, it's the primary way in which we treat these chronic conditions without necessarily doing more medicines or surgery. It's all about lifestyle. So what's interesting about the ACLM is they can actually and have definitively shown that they can treat various chronic conditions, including but not limited to cardiovascular disease, diabetes, obesity. So lifestyle medicine is formed by trained physicians who are interested in evidence-based medicine. These aren't just, made up. I found this somewhere on the internet. This is actually evidence-based medicine, peer-reviewed journals, things like that actually have proven to help people with these chronic conditions. And that's why I'm so excited about this. I am a member of the American College of Lifestyle Medicine, and I think that this will be the framework for how we're going to get you feeling better. Okay, so therapeutic intervention, that's kind of a fun word. Through therapeutic intervention, we can actually improve these conditions, and it's lifestyle. It's things that you can do potentially at home. It doesn't require expensive visits to the doctor. And we know that people don't want just more medication. I spent a lot of time on the internet in various groups and social media avenues, really talking to patients before I created this course, finding out what they wanted, what they didn't want, importantly, what they tried, what worked, and what hadn't. And I learned from that people do not want more medications. They don't want things just basically thrown at them from hey, take this pill and you're going to be fixed. And the frustrating part is, in many cases, even if they were to take those medications, it doesn't always end up with improvement. So they want lifestyle remedies, something they can do in the comfort of their own home. And that's what I'm going to offer. So lifestyle medicine really focuses on 6 different areas that they call pillars. So applying these pillars of lifestyle medicine, that's really how we're going to make a difference. And that's what the remainder of the course and the framework of the course is really built on. So what are those 6 pillars? Well, first and foremost, nutrition. Many of you have come from probably the world of low acid diets and avoiding certain things. And so nutrition probably shouldn't be too big of a surprise here. However, we're going to dive in a lot deeper. It's not just going to be about avoiding trigger foods. There's going to be a lot of other things related to nutrition. Physical activity is second. A healthy life, healthy activity, healthy body. That is a key pillar here. Sleep, that might be the first one that actually kind of surprises you. We're going to spend a fair amount of modules talking about sleep and how sleep interacts or essentially sleep and the restorative quality of sleep is essential in getting people better from LPR. Stress management is the next pillar. I am amazed at the number of patients that not only have stress because of LPR and potentially how LPR causes more stress. And it's kind of this cycle of just increased anxiety and frustration and stress. And so stress management is going to be great for us. Next is emotional and mental health. Again, very similar to stress management, making sure that back to our osteopathic principles from medical school, we're treating the mind, the body, but also the spirit. And so if emotionally and mentally we're not in a good place, then all these other key pillars are probably not going to do the job. And last, we'll spend probably the least amount of time on this, avoidance of risky substances. There are certain things that we need to avoid just for general health. But that's probably the area that we'll spend the least amount of time as it relates specifically to LPR. But these are the 6 pillars of the American College of Lifestyle Medicine, and this is the framework for our course. Okay, that's the end of that lesson. Stay tuned for more. Hi, welcome to week 2. I'm Dr. Morgan Yost, and I am super excited about this lesson. Today, we're going to talk about nutrition. We're going to talk about different ways that we can do some things at home to start getting you feeling better. I feel like the first week was really a lot of foundational information, and I feel like week 2 is where we're finally going to start making some things happen. So let me give you a basic overview of the week. We're going to talk about trigger foods, some of the things you may have already heard about, pretty common stuff that most who've met with ENTs have already heard. So that one will be probably pretty quick, but I hope to add some new things there. Second module will be about at-home remedies. This one's really great because we finally get into some things that you can do, fulfilling the course objective of giving you some clear throat options without necessarily having to visit a physician or expensive tests or medications. And then week 3, weight. We're going to talk about weight. We're going to talk about some things that you can do to start managing food and caloric intake. And it's going to be a really great lesson. I think this is a good week. So let's go ahead and get started. Okay, week 2, lesson 1. We're going to talk about trigger foods. This is Dr. Morgan Yost. Can't wait to talk to you about this one. There's going to be some great new information and a really important research study that I'm going to bring in that discusses probably one of the biggest topics that I found in discussing, getting a clear throat online on Facebook and various groups. And that's related to proton pump inhibitors. So what is the literature actually telling us? Unfortunately, at least in the United States, which is where I practice, and I'm sure other countries in the world would maybe find similar issues. But at least in the United States, about 75% of Americans are not getting the recommended amounts of fruits and vegetables. I find that quite concerning. We have great access to wonderful food, but we're just choosing not to eat it. So 60% of the food that's actually consumed in the United States has been processed in some way. That suggests that we're not getting fresh fruits and vegetables. We're not cooking things fresh at home. It's all packaged. It's all processed. It's all got additives. And frankly, a lot of times we don't even know what's in the food that we're eating. And so it shouldn't be a surprise that unfortunately our guts are not really satisfied with what we're doing. And as laryngopharyngeal reflux and GERD itself have a major role, I feel like this shouldn't be too surprising to people that we're eating horribly, and therefore our gastrointestinal tract is responding horribly to us. Okay, so this is a pretty standard slide. I think if most patients were to just get online, get into Facebook groups, start talking to people about acid reflux, this is a list that you're probably going to see a lot of places. This is the one that I traditionally start with in the office when I talk to patients, and I generally rattle off, you should avoid spicy tomato-based foods and citrus, avoid things like coffee and tea that have caffeine in them. Energy drinks and soda are a big problem. And I found this statistic pretty interesting that if you are drinking significant amounts of soda, you have a 76% increased risk of LPR, probably one of the major triggers. And I know in the United States, a lot of people drink a lot of soda. Additional things that I got from some research as well, research articles, greasy, fried, and fatty foods. Chocolate or mint is one that most of my patients get kind of frustrated with. They look at my list that I give them in the office and they say, chocolate? No. But in a minute, I'll kind of explain what I mean by this list. Alcohol is another major problem for a lot of people, particularly those that like to drink alcohol at night. It seems to cause major issues with reflux, especially with sleep. And then I kind of left a last little line here, many other things. You'll get online and you'll read and people will say, oh, this affected me and this affected me. While there are probably hundreds of different things that can affect acid reflux, I've tried to keep this list to what I would consider to be the top priorities. So going back to this, reaction that I get from people with chocolate, and it applies to all of them. It may be tomato-based foods, it may be tea or coffee, but invariably patients will always say, I can't give up so-and-so or such and such. I can't do it. And I'll often say to them, okay, we're going to be real world about this. You may not be able to stop all of these things instantaneously. There may be certain things that take some time for you to stop. But the amount of effort that you put into stopping these foods is really the amount of benefit that you get back in return. So I often say, if you feel like you can't give up coffee, you're going to probably have to live with some of the throat mucus that you have. If you're willing to come off of all of these things and be very diligent with them for an extended period of time, you're likely going to be able to get a clear throat. And then what I often say is reintroduce them. If you're really missing coffee, go back to having 1 cup in the morning and see how you do. There's got to be this point at which we allow the throat to heal. If we go back to the idea of pepsin basically irritating the lining of the throat and digesting it, we've got to give it some time for that to heal. And then we reintroduce something that we're missing, and then see if the symptoms return. You may be able to reintroduce coffee or reintroduce chocolate, whatever, and see how it goes. Some people, the second they have that thing, triggers them back again, back to throat mucus, and they ultimately decide, do I want to live with the symptoms or do I want to live with coffee, hypothetically? So I'm a realist on this. I've had some trainers and people who, taught me in residency that were really big sticklers on this, and they would actually get in arguments sometimes with patients about, not getting off all these different trigger foods. So I take a different approach. I give you the information, encourage you to do the best that you can. And the amount of effort you put into this is likely the amount of benefit that you'll see. All right. So there's a very important study in the literature that I want to talk a little bit about now. It was a research study where they compared in 2017, basically the effects of proton pump inhibitors and standard precautions, like what I just mentioned in the last slide. That was one treatment arm. Compared that to a Mediterranean-style diet and alkaline water. And what they did is basically took all of these patients and they separated them out into the 2 groups. And then they tracked them and they wanted to see, what was going to happen with just basically food and diet changes alone and alkaline water compared to what would be a very standard medical treatment that you would get in your doctor's office, which is a proton pump inhibitor and the lifestyle changes that I just mentioned on the last slide. So what did they actually find? What was the research study? Well, the study concluded that patients who were able to stick with this plant-based diet, this Mediterranean diet, did better than those that were on the proton pump inhibitor and the standard precautions that I mentioned. So this is a good opportunity to introduce the RSI, what we call the Reflux Symptom Index score. And that's a key indicator of basically not only the diagnosis of reflux, but also our treatment responses. So in the research study, they showed that about a 6-point reduction in the reflux score is clinically significant, meaning a patient can actually sense that they're getting better if the RSI has gone down by 6 points. And so that was their standard in this study. And if they saw a 6-point reduction, the patients were generally clinically improved and also felt that the therapies were working for them. And one of the things actually, mostly, hopefully before you actually started this masterclass, you've hopefully taken the RSI and gotten a number for yourself. And that's going to be kind of the baseline of where the treatment's going to go from here. So using the standard precautions, like I mentioned, and a proton pump inhibitor, patients could expect a reduction of about 54% in their symptoms. And we're going to get to proton pump inhibitors in a little while. A lot of patients are leery of these. A lot of press has kind of brought to light some of the side effects and problems with these. And so what would be kind of considered standard therapy at your doctor's office is really not what most patients are wanting. So standard precautions, proton pump inhibitors, about 54% improvement. What's interesting for me, though, is this idea of alkaline water and a Mediterranean diet. They actually did better with a 63% reduction in their symptoms. So lifestyle changes are better than a proton pump inhibitor. So the standard PPI group's RSI was reduced by about 27%. So depending on where they started, they could see about, a 27% reduction. Some of that, of course, did meet that 6-point reduction. And so, yeah, those patients did in some cases feel better. However, alkaline water and the Mediterranean diet actually saw a reduction in the RSI by 40%. I mean, nearly half, essentially. So, patients who are pathologically elevated on the reflux symptom index score, sometimes in the 20s and 30s, could see a 50% reduction and essentially get down into a more normal range. So I think that this study is pretty important to recognize that there's a lot out there on food and diet that could make a big difference, and in some cases even better than the standard, traditional Western medications like a proton pump inhibitor. Okay, so let's talk about PPIs or proton pump inhibitors. Why do people care so much? Why do they want off them so bad? Well, one of the first things to bring up is that medication errors are a major problem in our medical system. We also worry about interactions. I take medication A to treat a disease A, but I also take medication B to treat disease B. Well, do medications A and B interact? And then all of a sudden you're taking medication C to counteract a reaction that's happening with medication A, and on and on and on. I kid you not. I have patients who come in on 10, 15, 20 medications. And I often question them, like, okay, why do you take this one? Well, it's because I'm nauseous. Well, why are you nauseous? Well, it's because I take this medication. Well, you're nauseous on that medication because of a different one, and just on and on and on. And they probably spend their whole day trying to track out what medications they take and which ones they can't put together and which ones shouldn't. So I think medication errors and medication interactions are a major problem. One of the biggest things I talk to people about in the office is, what medications can we get you off of? Which ones don't you need? So I think that's step one. The second thing about proton pump inhibitors I think is super important is they're not without side effects. They're not without complications and problems. So just to list a few: abdominal pain, nausea, diarrhea, stomach pain, low magnesium, low calcium, stomach polyps, even low B12. All of those things have obviously a negative side effect and can affect quality of life. It has been shown, and this is not meant to scare, but this has been documented in the literature, it does show an increased risk of heart attacks by twofold for patients who have taken long-term proton pump inhibitors. A few years ago, some studies came out suggesting some other problems with proton pump inhibitors, including increased risk of osteoporosis. There was even a study that suggested potentially increased rates of dementia. That one was refuted and may not necessarily carry out truly in the literature. But I think what I'm trying to present here is this idea that standard therapy that you're going to get in your doctor's office is not without its problems. We got to find a better way. And I think in many cases, a proton pump inhibitor is not what we need. So that's the end of the lesson. That's trigger foods, standard precautions, and this idea of a Mediterranean diet actually being superior to traditional medications. We're definitely going to talk more about alkaline water, and we're going to talk a little bit more about some diet stuff. So stay tuned. We got lots more to talk about. Hi, Morgan Yost. I'm here. Can't wait to start week 2, lesson 2. This one's titled At Home Remedies. And we're basically going to hit 3 key points here. I'm going to show you a couple of fun things, share with you a recipe for something you can make at home to help with your symptoms. And this one's fun. I think this will be great. Okay, so first, we got to talk about something called pepsin. Up to this point, you've heard a lot of phrases: LPR, GERD, reflux, throat reflux, silent reflux. A lot of different things have been thrown around, and most of it, honestly, is focused on acid. A lot of times you'll go see a provider, and they're going to basically say you have acid reflux. To be truthful, that's good. That's partly true, but unfortunately, it's not just acid that's coming up into the throat. There is this stomach enzyme called pepsin that I think we need to talk about. So first, what is pepsin? Well, pepsin is part of the digestive enzymes that are created in the stomach to help us with food. So the first thing I try and point out here is pepsin is good. We want pepsin. It's got to be in the right place. Pepsin is supposed to be in the stomach. It is not supposed to be in the throat. Its job in the stomach is to basically digest proteins. The foods that we eat, they hit our stomach and pepsin interacts with acid to create basically a chemical reaction to break down the food. And so pepsin will help to digest basically any sort of protein that it comes in contact with. Well, the key here is the throat is actually made up of protein. So what does pepsin really have to do with my throat? And that's a great question. I think that pepsin is actually probably one of the main issues with throat reflux. They've even done research studies and shown pepsin in the nose. They've shown pepsin in the sinuses. They've shown pepsin traveling all the way up through the eustachian tube and out into the ear. They've done research studies where they actually aspirate or suction fluid out of kids' ears, and they found pepsin in there. So we know that basically pepsin is anywhere in our upper aerodigestive tract. Basically, anywhere above the stomach, you can find pepsin. So in simple terms, pepsin digests tissue, and it can start even digesting our own throat and nasal linings. It can digest basically that mucous membrane that's supposed to help in our throats. It can start to sort of digest those linings. So that's the reason why pepsin is so important. Let's talk a little bit about some high school chemistry. Probably not something most of you really want to talk about, but we need to understand the idea of pH. pH is basically a scale that breaks solutions into whether they are acidic or whether they're basic. And it's a little counterintuitive. Low pH equals acidic. High pH means basic. And normal, for simple terms, we're just going to say is about 7. So anything lower than 7 would be considered acidic. Anything higher than 7 would be basic. We know that pepsin is activated when it's at a low pH or an acidic environment. That's why it works in the stomach. Acid from the stomach activates pepsin, does its job to digest our food. Well, here's why it's important in the throat. Acid and pepsin in the throat interact to start to digest our throat lining. Okay, so this is why alkaline water is so important. Alkaline water is a type of water that's commercially available at any grocery store, and you just go down the water aisle and you'll find it. We can make some suggestions for what you might need to look at the store, but essentially alkaline water is commercially available, and it generally has a pH greater than 8. I know I've personally bought some in my own local grocery store that had a pH of 9.5. So you want to go down the aisle, find some alkaline water, find a pH, again, that's greater than 8. The research studies have suggested that it probably doesn't matter whether it's 8, 8.5, 9.5. So find whatever alkaline water you can and find something that's greater than 8. We know that a pH greater than 8 should inactivate pepsin, okay? All right, so how does it work? Well, I want you to create a solution that you're going to be able to spray into your throat, into your nose, and even potentially kind of inhale into your airway that will help to inactivate the pepsin. I lovingly call this pepsin potion. It's our magic potion to inactivate pepsin. So first, here's the recipe. What I want you to do is get a bottle of alkaline water. You're going to need at least a liter. The personal bottle that I bought came in a much bigger, I think it was, several liters. But anyway, buy at least a liter. What I want you to do is mix 1 liter of alkaline water with 1 tablespoon of baking soda. Baking soda is actually chemically sodium bicarbonate, which is a basic substance. So you mix that in with the alkaline water, and you're actually going to take the pH even higher, and that's going to inactivate the pepsin. So the idea is to get the alkaline water into the tissue so that it can actually help to inactivate the pepsin. Now, there's 2 ways that I've done this and 2 different options that you have depending on what nasal or oral symptoms you have. There may be opportunities to use different types of solutions. So the first one I'll show you is through a nasal spray. This is actually a commercially available spray that actually has just plain saline in it. At a pH around 7. What you can actually do, and I've taken off the label, you can actually pop the top off of this and then fill it with your own pepsin potion. What's nice about this, and I hope the camera can show you, is that it creates an aerosol. I don't know if that's showing up necessarily on the screen. This one I particularly like because it allows you to spray it into your nose. This is really great for people who have a lot of nasal congestion, postnasal drainage. They feel like they're getting some of the LPR into their nose. I love this one basically to just kind of help rinse out my nose, clear my sinuses, and help to thin some of the secretions that I'm getting, particularly nasal symptoms. The other nice thing I like about this one is you can actually aerosolize it and breathe it into the airway. And I think that it gets down closer into the larynx, into the voice box. So the way that I do that one is I basically take a big deep breath in and out, and then I inhale while I'm spraying it. And I'll even show you right now. So breathe out, in. So I'm breathing that in while I spray, and that's going to go down my airway and help to coat the larynx itself. Particularly doesn't taste too bad to me. I think it's wonderful. This is really nice for a lot of people who have more chronic cough, hoarseness, feeling like a lot of things are kind of stuck down in the throat. I think that this inactivates the pepsin and helps to loosen up some of those secretions. So that's option one through the nasal spray. You can buy this, and we'll get a link in the resources section where you can know exactly which one I bought. Truth is, I'm dumping all that stuff out and I'm replacing it with Pepsin Potion. The only reason you need this bottle is because of how it aerosolizes it for the nose and for the airway. Okay. All right. The second option that I like is a spritz bottle. And I find this one to be very helpful, particularly for the mouth. A lot of people get what we call burning mouth syndrome, where basically acid and pepsin get into the back of the throat. It irritates the tongue, and people will oftentimes come to see me because their tongue hurts so bad. This one's really nice because it allows you to spray directly onto the tongue itself. I don't particularly have any Pepsin Potion actually in this one right now, but spraying all along the mouth, along the sides, on the tongue, the floor of the mouth, you can really get a lot of this Pepsin Potion in and around the mouth. You can, and I have done a little bit with spraying this one and trying to breathe it in as well. I do like the nasal spray one better for if I'm trying to get it down more into the airway. I really like this one if I'm trying to coat my tongue particularly, or the sides of my mouth. As far as a dosing instruction on these, really the literature suggests that it's just alkaline water and baking soda. So there's really no upper limit necessarily. I think you can just use it symptomatically. So whenever you're feeling a lot of secretions, a lot of mucus, maybe a lot of nasal congestion or burning in the mouth, you basically can use these throughout the day. Cook up a couple of these and have one maybe in your work environment, have one at home, maybe potentially in a purse or backpack. So these can, I think, in theory, go wherever you want. They're really nice. And I think the Pepsin Potion is a great way to inactivate the pepsin and stop the irritation and the destruction that it's causing, and basically give your throat a chance to heal. So some other home remedies, particularly that I like. We think that a lot of LPR and acid reflux is happening at night. And this is just a situation of physics. When we're awake in the day, we've got gravity on our side, keeping the acid in our stomachs. When we lay down at night, we lose that benefit of gravity. And now all of a sudden, acid has free reign basically to come up from the stomach and get all the way up into our aerodigestive tract. This is, I think, why we're finding pepsin in patients' ears, even because of gravity issues. So one of the number one things I talk to my patients about in helping to manage reflux at night is to elevate the head of the bed. A lot of people have woken up in the middle of the night with heartburn and indigestion. What's the first thing they do? They go sit on their couch. They, take a drink of water to try and rinse that down. They take some Tums, they take some antacids. But the key feature here is they've woken up, and then gravity is on their side, taking that acid back down to the stomach. A lot of beds these days are electronic. They have a raising feature. It's very nice, very convenient. If you happen to already have one of those types of beds, definitely use it. Elevating, we think between 3 to 4 inches is helpful. We don't want it so much that you're sliding out the bottom of the bed, but definitely giving yourself a little bit of incline. A lot of people will talk about using wedges or pillows. Truthfully, I don't think they work. You may start out the night on your pillow or wedge, but you probably aren't ending up on it at the end of the night. We can't guarantee how much time you're actually spending at the incline. So elevating the head of the bed is the gold standard. So what about people who don't have an electronic adjustable bed? Well, a little bit more work here, but what you can do is basically go and buy some bricks or blocks or something that can elevate the whole entire headboard or frame of the bed, so that you're elevating the entire bed. 3 to 4 inches. So, a couple of bricks at each headboard side should do the same trick for you. I find that to be very simple and easy to do. So elevating the head of the bed at night is a must for trying to combat acid reflux and symptoms at night. Okay, another really important one, home remedy, simple thing to do, is avoid late night eating. So eating, as we know, basically primes the stomach. Even just talking about eating, looking at this picture of someone eating can even trigger the brain to start producing gastric enzymes, stomach enzymes to start digesting that food. Before you've even taken your first bite, your stomach is getting ready to digest that food. Well, if you eat that food and then right after you go and lay down, we've already talked about how gravity is no longer on your side. The stomach is full of acid and pepsin, and guess what? It's going to go right up into the ears, nose, and throat. So I recommend to my patients that they should not be eating 3 to 4 hours before going to bed. Of course, there's exceptions, people who do shift work, graveyard, there's all these, other options. And this is something that you have to customize for you. But in theory, let's say you go to bed at 10 o'clock, you should stop eating between 6 and 7 p.m. That's a key feature here for trying to avoid getting acid and pepsin up into your throat and reducing your symptoms at night. Okay, next, well, what about medications? I do take a lot of medications at night. What am I supposed to do? I think it's reasonable to have a small glass of water to take your pills, but I don't think that necessarily we should be snacking or eating. There's even been some research that, a lot of water can potentially prime the stomach. So I think it's important to be reasonable, have a small glass of water, and that's okay. In my opinion, I've not seen a lot of my patients have particular issues with that issue. So again, trying to be a real world provider here and not be too strict on what you can and can't do. Okay, in summary, Pepsin potion. Mix that up 1 liter of alkaline water with 1 tablespoon of baking soda. Pick your favorite applicator, get both, try them out, see what you think. I think that's a great symptomatic relief, something really easy to do throughout the day and potentially at night if you're having a lot of issues. Second, elevating the head of the bed. It's a must. We want gravity to help keep that acid and pepsin in the stomach. And last, we've got to avoid late night eating. We cannot prime the stomach and then go lay down. We're absolutely going to get stomach acid. So that's a key. So those are the key summaries from basically some at-home remedies. Okay, that's the end of the lesson. Can't wait to share some more with you. Thanks. Welcome back. It's Morgan Yost. We are week 2, lesson 3. This is going to talk about weight. We're still talking about nutrition, and the American College of Lifestyle Medicine is one of its pillars of nutrition. And so I decided to talk a little bit about weight in this lesson. I think this is one that gets glossed over a lot of times, and we definitely have an obesity epidemic, at least in the United States and potentially worldwide. And I'll try and explain why weight is an issue and how it relates to LPR, laryngopharyngeal reflux. I'm going to hopefully be able to give a wonderful opportunity for ways that we can help with that. So here's the issue. Extra weight equals more acid. So many people are carrying extra weight in their chest and belly. And unfortunately, we talked in the last lesson about gravity. Well, in the weight issue, we've got pressure on our side, or we got pressure fighting against us. So with no abdominal weight, no significant chest weight, we're not doing anything to push on the stomach. Unfortunately, if we carry a lot of abdominal weight in this area and we're pushing, basically we lay down and that abdominal weight is pushing down on our chest cavity, pushing down on our abdomen, it's going to unfortunately compress the stomach. And the stomach really only has 2 ways, either back up into the esophagus or down into the small intestine. It's going to eventually make its way up into the esophagus again. So more pressure on the stomach leads to more acid. And we find this to be true both with GERD, true gastroesophageal reflux disease, but also LPR, laryngopharyngeal reflux. So what can we do about this excess abdominal weight, and how can we make that change? So the American College of Lifestyle Medicine recommends certain exercise regimens. So they're recommending about 150 minutes per week of exercise. And what I like about this is, again, they're giving kind of real world opportunities here. They're not saying it needs to be 150 minutes of CrossFit or 150 minutes of running. I mean, really, they're just saying any sort of physical activity. And what they really want, and what I'm recommending, is you got to get started somewhere. So start low, start slow, find a routine that works for you. Maybe all that is going for a walk. Maybe you're already out walking. Maybe it's a jog. Maybe you've got an elliptical in the basement that you haven't used in the last, 2 years. So find out what works for you and find a way to incorporate 150 minutes per week of gentle physical exercise to begin with. Of course, we can increase the intensity as we need to. But what's interesting is it doesn't necessarily matter the intensity of exercise to begin with. It's more about the quality. It's more about the number of minutes and actually just doing something. All right. So there is a correlation between physical activity and health. And we know that that's critical. We understand that a sedentary lifestyle has its health risks for sure. I was quite staggered by this, and I talked to my patients about this. A sedentary lifestyle is linked with all-cause mortality. What that means is if you're sedentary, you're more likely to die. That's not, again, meant to scare. It's meant to motivate. It's meant to get you out doing some sort of physical activity to try and get things going. This can also be linked with asthma and cancer. So if you need any sort of motivation to just get out and start doing something, I hope that this slide can give that to you. We need some time, 150 minutes a week out doing some sort of physical activity. Okay, so how are you going to do this? Maybe you already know. Maybe you just haven't been exercising in a while. Maybe you're very fit and active, decades ago, and it's just kind of slipped away. But maybe you're not quite sure where to begin. So I want to kind of share a personal story and talk about an app. I do want to preface this by saying I don't own MyFitnessPal stock. I don't have any vested interest in the company. This is just a well-known app that you can buy. It's free, actually, that you can pay for some upgrades and such. But essentially, it's a free app. I have no commercial relationship with them whatsoever, but I have used it personally. And so I feel like I can comment on it and give you some real world experience. So it's an app that really allows you to customize a plan to accomplish whatever it is you want. Maybe there's certain weight loss goals. Maybe there's certain strength goals. And what's nice about MyFitnessPal is when you very first log into it and create an account, you're going to put in your basic demographics, like your height, like your weight. They're going to ask you if you're looking for weight loss, if you're looking for weight gain and strength. They're going to ask you about all those things, and you can customize your goals with the app, and then it will present you with a plan. So again, my story, I wanted to see if I could lose 10 pounds, and I logged into MyFitnessPal, and I basically said, okay, I'm at X pounds and I want to lose 10 pounds in 10 weeks. And so what they did was they basically calculated where I was at and where I wanted to be. And they came up with a certain amount of calories that I was allowed to eat per day. And at first, this was kind of weird. I'd never counted calories before. I'd never really looked at the foods that I was eating. I, to be honest, wasn't even really aware of how much or what I was eating per day. And so this became a big game for me to see if I could actually stick with the plan and see if I could lose the 10 pounds in 10 weeks. So what's nice about MyFitnessPal is it allows you to track your exercise. It allows you to track your food. And you can even keep track of water intake. It can link to sleep tracking. It's a really nice app for a lot of different things with fitness. And I really liked it and used it aggressively to kind of help me navigate this process of losing 10 pounds in 10 weeks. So what I would like you to do, and this is one of the first, action steps that I have for you in this week, is to download MyFitnessPal. log in, put in your demographics, choose a plan that's going to allow you to start navigating some general nutritional health and wellness. So I would encourage you to, if you have particular weight loss goals, tell it to MyFitnessPal and start tracking your calories. Start watching the foods that you're actually eating. I bet you'll find it pretty amazing, the amount of calories that you get just from little snacks here and there. Those sodas add up, those cookies add up. And I know for me personally, it really allowed me to start making some more healthy choices, kind of going back to the beginning of this whole week, talking about the processed foods, talking about how we're not getting enough fruits and vegetables. I was amazed at how many fruits and vegetables I could eat caloric wise compared to, a processed sleeve of, donuts or cookies or something like that. The calories were just unbelievable in the processed foods. And, if I made a healthy choice and had, for example, an apple or some strawberries or raspberries, I was amazed at how few calories that was. It actually allowed me to have more to eat throughout the day with less calories. So step one, I want you to partner up with a friend. Now that can be in your personal life, someone you already know, maybe a spouse, maybe a sibling, maybe a child, somebody that you know that you're wanting to kind of take this journey with. It can also be potentially on MyFitnessPal. You may find that some of the people that you know are on MyFitnessPal, and it will even link you up and say, hey, your friend so-and-so is on the app, and you could potentially be friends with them. So I want you to download it. I want you to get an accountability partner, and I want you to track your calories for an entire week and really start to see how many calories you're taking in. You can also import your exercise, your 150 minutes for the week. And you can actually put in whether you're walking, whether you're jogging, riding a bike. It has all these different options for, putting in your calories. What I loved about this, and this was really fun for me, let's say I knew I had a party or something with let's say a birthday party, and I knew that I was going to be eating some cake and ice cream for the birthday party. Well, that day I could particularly exercise more, upload that into MyFitnessPal, and it would actually bonus me some extra calories that I could have and not count against my total for maintaining my 10 pounds in 10 weeks goal. And so that was really nice on days that I could plan ahead and do maybe a little bit more exercise to accommodate some of the lifestyle changes or lifestyle decisions that I was going to make later in the day. So that was really fun for me. So get a partner that you can take this journey with and track your calories for an entire week. I bet you'll find it very illuminating and actually probably pretty surprising. Okay, that's the end of the lesson. I think this is the first opportunity to really push you into some significant change. Up to this point, I think it's all been theoretical. This is reflux. This is why it happens. This is some of the stuff we can do. But I think at the end of this week, if you really want to make changes, if you really want this to work, if you want to see your symptoms and your reflux symptom index score go down, this is the chance to really make it happen. This is the week to do it. All right, welcome to week 3. So this week is all about physical activity. Again, I'm Morgan Yost. I think that this is the week where we maybe start branching out into some of the things that are not typically what you read about with acid reflux, not things you typically hear about with ENT visits. This is really focused on the American College of Lifestyle Medicine and a couple more of those pillars. So to give you an overview of week 3, we're going to talk first about physical wellness. We're then going to talk about emotional and mental health and wellness. So these are 2 pillars that, again, I think oftentimes are not really discussed in the context of LPR and throat reflux. But that's also why I think this week is so important, because we're going to give you some of the sort of alternative options, things that people don't often look at. So I'm really excited about this week. So let's go ahead and get started. Okay, welcome to week 3, lesson 1. This is going to be all about physical wellness. And again, I'm your course director, Morgan Yost. We're going to be talking about some really great stuff today. To be honest, today is a very personal lesson for me. I'm going to kind of walk you through some of my own history and my own story, especially how physical wellness applies to me. So I don't know how much you know about medical education and training. If you know anyone who's been through that process, it's a pretty grueling thing, not to diminish from others who've gone through professional programs, but medical school and residency are often considered very difficult. So a little bit about my history. I kind of always knew I wanted to go to medical school. And so I didn't take a lot of time off. I went straight from high school to college, college to medical school to residency, and so on. And just to give you kind of a framework on that, college was able to finish in 4 years with a degree in biology and a minor in chemistry and Portuguese. I lived in Brazil for a couple of years, so I learned to speak Portuguese there. Went straight to medical school. And again, we've talked a little about this. I went to an osteopathic medical school in Missouri called Kirksville College of Osteopathic Medicine. So that was 4 years. Pretty rigorous training, a lot of classes, a lot of labs, a lot of patient encounters. Really heavy for the first 2 years in studying. I felt like it was like college on steroids. Like the things I would learn in a week of college, we would go over in a day in medical school. And it just felt like I was constantly learning and never had time to catch up. So on top of just learning the material, though, there are all these big tests that you have to take, basic steps, we call them. There's a big test after basically each year, second, third, and fourth year, where you're going through the process of basically certifying that you've learned enough in medical school to graduate. It's also that test that helps you get ready for residency. So you're constantly studying for your classes, but then you're also constantly feeling behind and studying for these various board examinations and steps. So yeah, at the end of 4 years of medical school, to be truthful, I was pretty burned out. I was lucky enough, I think, at this point to get into a medical residency for ear, nose, and throat surgery, which is 5 years. I completed a 1-year surgical internship and then 4 years of dedicated ENT residency. These are kind of the stories of, 80-hour work weeks, and, not that all the TV shows online are true representations of medical training, but I'm sure you get the gist. You've seen the stories, you've seen the shows. Residency was no joke. It was pretty rough. So to say that I had no time and a lack of emotional energy is an understatement. I feel like my entire physical wellness was absolutely in the back seat. I didn't make time. I'll avoid using the word have time because everyone has the same amount of time, but I didn't make time for any sort of physical wellness. And I suffered for it. I was not really in a great place and not very happy and pretty frustrated with my own physical health and wellness. So I want to talk a little bit about my wife and my family and kind of give you some backstory here. My wife and I actually met when we were very young through my sister, who was really good friends with my wife. So we ended up starting to date in kind of our early 20s. And kind of a funny story, my wife is the opposite of me. She's always been very healthy, always been, physically active, likes to run, likes to do yoga and lift, and just really a great example to me. Well, on one of our first dates, I kind of made the mistake of saying, "Oh, I love running." And she's like, "Okay, yeah, let's go running together." So she invites me to go on this run. And granted, I probably haven't run more than, down the street to catch a bus or something in years. I played soccer when I was a kid. I, did some physically demanding things when I was younger, but I really hadn't done anything physically demanding for quite some time. So we decide we're going to go on this run, and I get all, jacked up, ready to go. And I'm in, performance mode. I'm going to show her that I love running and that I'm really good at it. So we end up going out on this 5 or 6 mile run. Actually went and ran some hills, had quite a bit of elevation change, and I put on a show. I ran like I was amazing at it and I knew everything. And behind the scenes, I was dying. Like I didn't know if I could take one more step, but of course I didn't, want to give up. I didn't want to show her that I wasn't a good, husband material kind of stuff. So later, years later, she kind of tells the story back that she was quite impressed and she couldn't believe that I could run so well. And she thought she'd found the catch, right? Well, we go now probably 10 years without running again. This corresponds with kind of my entrance into, well, kind of the end of college and sort of the entrance into medical school. So imagine this. I've told my wife that I love to run and I'm, amazing at it. She thinks it's awesome. But then I slip into this phase where I don't run or do anything physically active for a long, long time. I'm actually kind of surprised she stuck with me after all of that, and tried not to trick her anymore after the running experience. All right, so let's fast forward to finish with residency, move back to Idaho to my first job, and I get an opportunity to get a job at the hospital in my hometown, and just everything in life is starting to pick up. I have more time with family. I have more, emotional strength and energy to start doing some things. I often talk to medical students and residents about how up through your medical training, you basically are mortgaging your whole life. Everything you love to do is put on the back burner, and you're forced to just focus on the task at hand, the train at hand, the test at hand. So, all right. So this is 2014. We finally start to, get some time and some opportunities to do a few things for mental health. And I happened to be at a conference in LA and had a chance to go and try out this cool new treadmill that had just hit the market. And they had it in a demo store that you could go to. And I went in, and my wife had already been talking about how she needed a new treadmill. She'd run a few marathons while I was in, I think, medical school and maybe residency. I think medical school. And she'd basically worn out our treadmill. So she had already been talking about how she needed this new treadmill. And I was like, okay, I'm in a place where I really got to start doing better. So I go and try out this treadmill. I end up deciding this is perfect for us. Let's do it. I make the mistake that everybody makes when they think they need to work out more. They go and buy an expensive piece of equipment. But in our situation, that actually was one of the best things we've done in a long time. So this particular treadmill, without saying too much about, particular companies, and I'm not a spokesman necessarily for them, it's basically a treadmill that allowed you to have a big screen with interactive classes with instructors. And so there was this connection with somebody. I was not just running on a treadmill alone, but I was in a class with somebody, or I was being followed by people and following friends on this platform. And it just really became very quickly something that I actually looked forward to. And I started to increase sort of my mental and physical health. So at the same time, I was introduced to an app called Strava. And I'm not sure how many of you know about Strava, but basically it's kind of like a fitness app where you can combine social media with fitness. And this came about because when I moved back to Idaho, I started mountain biking, and my older brother, who's very fitness conscious, had suggested Strava. And so I downloaded it. So basically what happens is you log into Strava, you create an account, you talk a little bit about who you are and sort of what you want out of it. And then it gives you an opportunity to start exercising, and you can track all of the exercising that you're doing. What I really liked about Strava was this idea that you had friends on there, so people who could see what you had done. But there's also these things called segments, where basically people have tracked, say, a mountain bike trail, and they keep track of how long it takes you to get from point A to point B. Maybe it's climbing and you want to be the best at climbing. Maybe it's actually point B to point A, and it's how fast you can go down the hill. Well, Strava tracks that for biking, both mountain and cycling. They track that for running, for walking. All sorts of these segments exist everywhere that we live. People who are on Strava have created these. And I became very competitive with this and really found myself every day wanting to exercise. And in my feed, I could also see what other people were doing to exercise. And so it became this very social thing. And in my estimation, it was a positive social experience. I wasn't necessarily feeling bad about what other people were doing. It made me feel excited to go out and maybe try and run up that hill to see if I could compete with my brother, or maybe go mountain biking and see if I could, go faster down this one trail or something. And when you're in Strava, after you complete an exercise, basically it posts to everybody's feeds. And then what's really cool, in my opinion, is you can give kudos, where you can go in and say, "Hey, good job, so-and-so," or in reverse, you can actually get people who say, "Hey, good job, Morgan, you did a great job today." So this created kind of this sense of accountability and encouraged and motivated me to keep going. So between our new treadmill and Strava, I really blossomed during probably 2000, I'd say 18 and 19, where I really got into just being generally healthy. And I mean, you can see me on the screen. I'm not a bodybuilder by any means. I'm not the most fit, but I am more fit than I've ever been in my life. And it has really helped me emotionally with stress and anxiety of starting a new practice, with being an ear, nose, and throat surgeon. Exercise for me has been a really great opportunity to just feel better. So that's what Strava did for me. So at this point, there may be this idea that, you've got to be the next marathon trainer. You've got to do a half marathon or run a 5K, or, sometimes people feel maybe motivated to do some of those big, grandiose things, but maybe that's not where you're at. Maybe it's simply something like, I need to start walking. I need to get outside and just do something physically demanding. Maybe I've got a treadmill in the basement that I haven't used in years. Maybe I've got a cycling bike that's been sitting in the garage. So what I want to kind of come across in this training is, you don't have to be me and I'm not you, but I think that all of us can start doing something to connect socially and in a positive way in terms of physical exercise and physical fitness. So we need to find something that motivates you and something that's going to allow you to have fun and stay on track with it. And again, it doesn't have to be my same journey, but I want to hopefully create an opportunity where you can create a journey for yourself that leads to the same type of emotional and physical wellness and health. So the benefits are worth it. Not only does physical activity have this significant physical effect, but it also helps with mental and emotional well-being. It's really great for just feeling better. So what does this have to do with LPR, throat reflux, mucus in my throat, globus sensation? Sort of why would I spend, the last 10, 15 minutes talking about being physically fit and exercise? Well, it has to do with this connection between body weight and LPR. We know, and we talked about this in week 2, that a lot of people carry a lot of extra weight in their chest and their abdomen. And when we go to lay down at night, that extra weight is pushing basically on the chest and abdomen and creating increased pressure in the stomach. We talked about in week 2, there's basically only one intake and one outtake of the stomach. And if you are putting more and more pressure, it's got to find a way out. And likely it's going to go up the upper esophageal area and go into the throat. So it's not just about exercise. It does help us potentially to lose weight and can help to shed some of those pounds that are putting extra pressure on our chest. But, mechanical improvement is definitely important. And I'm glad we can talk about this here. But what the focus really of this week is not necessarily that you all need to, be a certain body type or body size. No, what I'm trying to encourage is mental health and wellness. And as a result, if there is weight loss, then you might see an improvement in some of this increased pressure in the stomach. And that, I think, will help with the throat reflux. So I kind of already alluded to this. What does this have to do with my throat? Well, as an osteopathic physician, we've talked about this. It's all about the mind, body, and the spirit. So I think many, many times in medical training and medical teaching and medical visits, it's all about the body. You're just focusing on, you have high blood pressure, so you have to take this high blood pressure medication to bring it down. But we oftentimes don't really focus on, well, what does my high blood pressure have to do with my anxiety and my mind? What does this have to do with how I feel spiritually or emotionally in my connectedness to other people? And those that suffer with LPR, they seem to have a real significant fixation on their symptoms. I'm amazed as I, get into Facebook groups and chatting with patients online, I'm amazed at how much their symptoms bother them and what a focal point this becomes in their life. It's almost as if they can't move past it because their mind just keeps coming back to it. What's wrong with me? Why do I feel this way? Do I have cancer? All of the things that ultimately brought you to this course, it really messes with people's minds. So another natural benefit of exercise is this idea of, basically pleasure hormones. You've heard about the runner's high or endorphins or different things. It's a real effect. It's amazing what you feel after you've been able to sort of pick out a goal and accomplish that goal. Maybe, again, it's a half marathon and you go and run that half marathon, and all the training leading up to it culminates at that moment where you said, I did it. Maybe it's not a half marathon. Maybe it's, I just need to get out and walk. Maybe I just need to do something, get off the couch, stop streaming, videos, and do something for myself, for my mind, my body, and my spirit. So that's the goal of today's module, is basically to encourage you that exercise is super important to treat the entire patient, including the mind, body, and spirit. So that's the end of this lesson. I know it was kind of drawn out and a lot of kind of personal story in the background. I hope that my story has been helpful and that some of what I've gone through might resonate with you and give you an opportunity to start making that same physical journey and change. Okay, see you in the next one. Okay, welcome back. Week 3, lesson 2, Morgan Yost here. Today is going to be all about emotional and mental health and wellness. I find this to be a carryover from what we've been talking about, but particularly we're going to focus a little bit more on mental health and particularly anxiety, honestly. So at the last lesson, we were talking more about physical wellness and how that can help us to feel better, but we're going to talk about some other techniques that we can do that will actually help more. So people are frustrated. I've learned this in chatting with patients over the years. I've heard this recently, particularly as I've taken to Facebook groups and talked to people who are frustrated with their medical treatments. They're tired. They're exhausted. They wonder if they're ever going to get better. They, are being prescribed medications that may or may not work, but then they're also having side effects with them. And we've talked a lot about, proton pump inhibitors and some of the other things out there. Patients are frustrated. So what I have found is that depression and anxiety have a significant role in medical therapy. And unless we can treat the mind, the body, and the spirit, we're unfortunately missing the boat for so many medical conditions. And I think throat reflux, LPR, is definitely one of them. So what is the research actually showing? Well, research shows that exercise is just as good as many of the prescription medications that are often prescribed for depression. It doesn't necessarily matter exactly what type of exercise you're doing. And here's a few examples, some basic, cardio exercising, yoga, meditation, lots of different things can be used. And that's not really what the research study was showing, but it was more of a comparison of patients who are doing some form of exercise. How did that compare to traditional pharmacologic interventions? And it actually shows that it's just as good. And I love that for patients, because that's one less medication they take on a daily basis, one less potential for a medical error, one less potential for side effects. So I'm really excited about that. Okay, so let's go to what does the literature actually say? Well, they did a specific study actually of 60 patients with reflux and 60 healthy control patients. And the reason I wanted to focus on this particular research study was because it's really, it's us. It's the patients that are in this masterclass. It's the people who really want to get a clear throat again. It's the people who have reflux. So using this particular survey that basically looks at quality of life, it showed that depression symptoms actually make acid reflux worse and reduce the quality of life. And I've kind of talked a little bit about this throughout the modules. Is it that anxiety and depression necessarily feed into reflux and cause it? Is it that patients who have acid reflux are more likely to feel anxiety about their condition? The truth is, it's probably one of these cycles where people who have reflux are more anxious about it. People who are anxious about it have more reflux. And so ultimately, that's kind of what this study showed, was that it actually does make things worse and reduces quality of life. This is a great opportunity to intervene then and start trying to break that cycle. How can we get patients to stop being anxious about it? And then that will conversely help to reduce their reflux. And as we reduce their reflux, it should hopefully help to reduce their anxiety. So this was a really great study that I particularly like to share with my patients. So at the end of this week, we've got a couple of summary and then action steps. So the first thing in summary is just physical activity and mindfulness-based stress reduction can relieve stress and break the cycle of LPR. We know that it's hard. We know that it takes time, but I think that this is the key to this masterclass, And this is what I promised you at the beginning, that we would give you improvement in your throat, getting a clear throat again, without expensive tests, without prescription medications. So we know that depression and LPR are connected in a negative feedback loop. This is what I've been talking about with basically which one comes first. And the truth is they both feed off of each other. So now for an action step. At the end of each week, I want to give you something that you can do, a checkbox, a milestone, something that really can mean something as you move forward. So this week, I want you to download Strava and log activity 3 to 5 times. And I want you to find a friend on Strava and give them kudos. Well, many of you may say, okay, wait, Strava is not available in where I live, or I don't necessarily want another social media app. Maybe you're already using a different app. So it, again, doesn't have to be Strava. I'm just suggesting Strava because it's one that I've personally used and have a lot of familiarity with. But find some sort of physical app that you can use to track your activity. Find a friend, an accountability partner, and find a way to make a connection with somebody that can hold you accountable for what you're doing. And hopefully in reverse, you can do that too. As we create an online community for those patients who are getting a clear throat again, we're going to have lots of opportunities for people to connect and talk and potentially find accountability partners even within our own community, potentially find accountability partners on some of these apps that I'm suggesting. And hey, I'm on Strava. You can see me, find me in there, and would be, fun to start connecting with people. And hey, you could see what I'm doing. And it's not just something I'm saying. And then, hey, message me and give me a kudos and tell me to start working a little harder. Maybe I'm not as fast up the climbs as I used to be, or maybe I need to get out and work a little more. So that's the summary for this week. Those are the action steps that I'd encourage you to do. And I'm really optimistic that this is going to help. This would be a good chance also to take a pause and figure out your reflux symptom index score. It might be a time to revisit that and see if you've seen any changes. A lot of times for patients, I don't really do a reflux symptom index score check for sometimes upwards of a month. Because I'm not seeing them on a regular basis. And that's what's really cool about this masterclass is we're getting a chance to interact as quickly as you want to watch these videos. In my, brick and mortar practice, I'm not seeing patients sometimes, back for 4 to 8 weeks even. And so it does give them a little more time to see that change in their reflux symptom index score. But it might be worth taking a few minutes and asking yourself the question, how have you felt this week? And see if there is any sort of change in your RSI. That'd be really fun to not only see maybe some physical changes as you start exercising more with last week's action step in combination with this week's. I'm really optimistic we're going to start seeing some improvement in symptoms and a reduction in the RSI. We'll see you in the next week. Thanks. Hey everyone, welcome to week 4. This is Morgan Yost. This week is going to be all about sleep and stress management. A couple more pillars that we get from the American College of Lifestyle Medicine. So the overview is basically going to start with the benefit of quality sleep, give you some suggestions on particularly why sleep is important, but also how to start getting better sleep. Module 2 is going to be about reducing stress. We talked a little bit last week about this feedback loop of stress and anxiety and depression feeding into reflux and reflux feeding into those. So we're going to try and teach you some techniques for reducing stress. And that segues nicely into module 3, where we're actually going to talk about the importance of meditation and some of the techniques that are out there, and ultimately give you an action step for something you can do to start some more meaningful meditation and mental health. So this is a really great week. Again, probably off the beaten path for anything you've heard related to treating acid reflux and throat reflux from your previous doctor visits. But I think that's why this masterclass is so interesting, is it's not the typical stuff. We're going to get you a clear throat without expensive tests and without prescription medications. So that's where we're at. Let's get started on this week. Hey, welcome back. It's Morgan Yost. This is week 4, lesson 1. We're going to talk about the benefit of quality sleep. Sleep is probably the least understood and probably some of the most helpful time that we have in our life. I've read tons on this, and I've watched a lot of master classes myself on this. And I really think that the benefit of quality sleep gets underappreciated. I can't wait to share some of the things that I found related to this topic for general wellness, but also in particular for throat reflux. So let's get started. Okay, so what is the research actually telling us? The American College of Lifestyle Medicine suggests that 70% of patients that come into their primary care offices are actually there for stress, anxiety, or poor sleep. So we've been touching on these topics. You know that these can be an issue. And I just was blown away that 70% of doctors' visits are related to just those three things. And I also wonder maybe if even stress and anxiety could be boiled down a little more into poor sleep. Maybe another one of those feedback loops. The poor sleep causes the stress and anxiety causes poor sleep, and it just makes things worse for patients. But yeah, huge problem for people. Okay. So sleep is like our reset button. The joke is whenever there's a problem with a computer, hey, have you tried restarting it? Well, that works a lot of times in tech things, and I'm amazed at how frequently that seems to be the problem. My phone's not working, reset it. Hey, it's working great. So think about that for basically our bodies, for our mind. Our mind is constantly being bombarded with information, with sights and sounds and new memories, and it needs time to reset and kind of process and reconnect some of those things that have happened during the day. While we don't fully understand dreaming, we think of dreaming as basically being that state where some of the bizarre and the, unnatural things that we may, be thinking about that our brain is trying to process basically play out in this visual context called a dream, where you can say, okay, it's not normal for this to happen. And that's why I then wake up in the morning being completely confused about what my dream was about. But we also have to understand that it's actually a time when our brains re-solidify some of the memories that we had. And so sleep is truly that reset button for us. And it's something that has to happen. I'm amazed in research that, all mammalian animals go through some sort of sleep process. I mean, sleep seems to be one of the most fundamentally key things that is carried across evolutionary timelines. It's amazing how many organisms sleep and how higher thought has really, we think, sort of grown out of this idea that sleep is important for us. So let's make the connection with, why does this have anything to do with acid reflux? Well, there's a couple of connections here that I want to make. First, we know that when patients do not sleep adequately, there's actually a corresponding increase in inflammatory markers throughout their body. You can actually draw blood levels for various inflammatory substances that circulate throughout the body, and you'll find those increased. Cortisol, for example, is one of them. C-reactive protein is another one. There's lots of research studies that show that poor sleep leads to inflammation. Well, we've talked a little bit about how acid reflux is an inflammatory process where stomach acid is getting up basically with pepsin and other molecules and causing an inflammatory response in our throat. So if that, on top of increased circulating inflammatory markers, we're just basically a recipe for disaster. That's why our throat hurts so bad. That's why we have so much mucus production. That's why we're chronically coughing and clearing our throat, because those areas are inflamed and irritated. And sleep gives us that chance to reset and get rid of those inflammatory markers and downregulate the inflammatory response. Okay, so back to a mechanical thing that we've talked about several different times, but as we're talking about sleep, I think it's important to talk about how to get the best quality sleep as it relates to acid reflux. So there is a mechanical reduction in acid when we're sleeping elevated. We want to elevate the head of the bed so that it's harder for, this acid to come up into our throat. Gravity, we want to be on our side. Also, what I think is important is that a lot of times reflux is happening at night and it's causing irritation in our throat, then leading to coughing episodes. And a lot of patients will come in either, of their own accord, they'll mention this, or especially their spouses will mention that, wow, my husband, my wife coughed all night long. And you can imagine how a coughing episode, a coughing fit would really interrupt the quality of our sleep, essentially akin to obstructive sleep apnea, where we never reach really a restful state because we're coughing, we're feeling irritation in our throat. And we may not even be awakening to this process, but it's definitely breaking up our quality of sleep. So we want to reduce the interruptions in sleep. I generally say elevating the head of the bed 3 to 4 inches is enough. There's a lot of people who will talk about, oh, I sleep on 3 pillows. Well, you may start on 3 pillows, you may not end. Some will get wedges, which again is an option for some people. Maybe if you already have one, try it. But I think that the true gold standard here would be to either use some sort of mechanical bed if you already have one that adjusts to go up 3 or 4 inches, or consider putting blocks or bricks underneath the headboard to guarantee that you are staying at that incline throughout the entire night of sleep. That should keep the gastric contents in the stomach and hopefully reduce the irritation in the throat and reduce interruptions in sleep. So we've touched on elevating the head of your bed for lots of different modules, but this is how it relates to sleep. Okay. So there is a connection between physical activity and sleep. I watched a master class that basically a researcher had talked with various professional athletes. And one of the things that seemed to elevate these world-class athletes beyond some of their peers actually had to do with the amount of sleep that they were getting. It's talked about that, muscle memory. The reason so-and-so can shoot so well a basketball or so-and-so can run so well is because of this idea of muscle memory. The muscles know how to do things. Well, the truth is the muscles don't do anything by themselves. It's actually all about brain memory. It's about the brain sending those signals to the muscles and then the muscles doing what the brain tells them. So the more sleep we get, the better physical performance we can actually expect. Staying up and trying to exercise doesn't seem to correspond with improved performance. In fact, taking naps and sleeping seems to be better. And there's one particular famous athlete who on game days will oftentimes nap more than they'll actually practice. So our ability to be physically active will help with the quality and the longevity of our sleep. So this is one of those positive cycles for us. As we exercise, we basically become fatigued enough that then we can enter into these better sleep stages. We can get a better night of sleep, and the better sleep then leads to better physical activity, reduction in stress hormones, reduction in inflammatory hormones. So this is the first time I think I'm talking about how things can actually work in our favor in a positive feedback loop. Sleep, physical activity, and sleep, it's all connected in a positive way. So getting that good quality sleep is essential, not only for general wellness, but particularly for LPR and throat reflux. So you might be asking yourself, well, what can I actually do to improve my sleep? The first thing I would suggest is a regular schedule. You've got to go to bed at the same time, wake up at the same time. Research has suggested that we don't take the weekends off. We shouldn't, stay up all week and then try and catch up over the weekend. We don't really see that playing out in the research. So having a regular schedule is absolutely imperative. Master class that I've watched talks about people who, are generally early risers and would want to get up going early in the morning and maybe go to bed earlier. And that maybe there's people who want to sleep in a little bit, but maybe go to bed later. Not everybody's biological sleep clock is perfectly linked, and we shouldn't all necessarily feel the same pressure to get up at the same time and go to bed at the same time compared with other people. But what this is suggesting is that we need to create a regular schedule for ourselves, and we really shouldn't be doing a different schedule on the weekends. So next thing I would encourage patients to do is get a good sleep routine. So this can be very personalized. It can be something that you do that works well for you. It may not work for everybody. Some examples of that could be maybe some light reading on a traditional book, trying to reduce some of that screen time, and maybe showering or even meditating or stretching. Showering in particular, or bath in particular, those are very helpful at helping to lower our core body temperature. And that seems to be one of the biggest triggers for us to go to sleep. And that ties nicely into sleeping cool. Not sure how many of you have potentially, been somewhere very warm or tropical, and it's oftentimes really hard to sleep. You kind of toss and turn because the body is not allowing itself to necessarily cool down, versus sleeping in a cool environment, maybe a mountain retreat or something, window open and temperatures dipped low, maybe the best night of sleep of your life. Well, again, the body needs that opportunity to decrease its core temperature. And so most researchers suggest sleeping with the temperature less than 67 degrees can facilitate and improve your sleep. So that's a really cool one. Darkness. Darkness is so difficult for us nowadays with all of the screen time and the lights and everything. So darkness is important for actually helping us to trigger the release of melatonin. Melatonin is a naturally occurring hormone that helps to stimulate our sleep-wake cycle. And melatonin is secreted in such a way that it helps to basically shut the body down and allow it to sleep. Well, melatonin is inhibited by light. So if we're staying up late watching TV shows, watching movies, doing screen time, we're going to downregulate that melatonin, and it's going to become increasingly harder for us to sleep. Now, I'm not going to necessarily introduce the idea of supplementing with melatonin. Many people do. I mean, the research suggests that it might help, but it may not be a complete fix for many people. I think instead, creating darkness in your sleep environment, turning off lights, reducing screen time, really avoiding screen time potentially for a whole hour before we get ready for bed. This idea of kind of shutting down the day. And then the flip side, some people may have said, well, it's really hard for me to get up and get going. Well, in the morning, that's when we want to turn on all the lights, open up the windows, really, if that's a good time to do screen time, get things going in the morning, and that will help us with more alertness. Another thing we can do to help improve our sleep is avoid caffeine, alcohol, and nicotine, particularly at night. Those things have been shown to increase blood pressure, cause more, alertness. And that's the exact opposite of what we're trying to do as we're trying to settle down for the day. Caffeine, alcohol, and nicotine can potentially make things worse for us. Now, alcohol is actually a sedative. So that one's not necessarily that it's ramping us up like the caffeine or nicotine is. What it is alcohol has been shown to potentially inhibit our ability to obtain restful sleep and may even make obstructive sleep apnea worse in some people. And so they're actually getting less quality sleep. All right, we've spent some time talking about exercise. We know exercise is good, but here's our one caveat of suggesting, well, late night exercise probably is not. Exercise does have this tendency to sort of increase our blood pressure, ramp up our autoimmune system, our autonomic system for this kind of fight or flight, a more increase, sort of stimulation with exercise. Well, that again is not really what we want late at night. So considering, backing off on the exercise at least several hours before potentially trying to get to sleep. And the last one is this idea of what we call the sacred bed. Basically, there's only two things that we really should be doing in bed, and that's sleep and intimacy. If you eat in bed, if you study in bed, if you watch TV in bed, your mind can get confused on really what you're supposed to be doing in that scenario. If the only two things you essentially do in bed are sleep and intimacy, when you're in that environment, it's much easier for your brain to basically shut off and get ready for sleep than if you're confusing it with all these other activities that may not necessarily be helpful for getting a good night's sleep. So those are my suggestions for what we can do to improve our sleep. And I think that there's a lot of room for improvement with these because most people, while you're maybe not doing all of them, most people definitely have a few problems here that they could improve on. And that may be the difference between getting that high quality sleep, that reset that we really need to allow our bodies to start doing better, both mentally, physically, and spiritually. So the next question is, well, how much sleep do we actually need to get? What really matters? Studies suggest that, some people will claim, oh, I sleep 3 to 5 hours a night and I do great. The research shows that those that sleep less than 3 to 5 hours, that sleep 3 to 5 hours versus patients who sleep a full 8 hours at night have a significant increased risk of LPR. And this is back to that feedback cycle. If we're not sleeping well, we're likely getting this chronic inflammation. And the risk is actually 129% increase of LPR in those that sleep 3 to 5 hours. So if you really want to treat your throat, if you want to get a clear throat again, you got to start sleeping better. And going back to the last slide and some of those suggestions would encourage you to start making those changes now because sleep is really one of the keys to getting a clear throat. Okay, that's the end of this lesson. Continue for more. We got lots of great stuff to teach. Welcome back. Week 4, lesson 2. This is Morgan Yost, and we're going to be talking about reducing stress. This is another one of the significant pillars of the American College of Lifestyle Medicine, and something that I think plays into almost every patient that I've seen who struggles with LPR and other symptoms like it. So let's get started. Okay, first I'll ask the question, did you know that 33% of the US population has some version of a diagnosed anxiety? And I wouldn't comment on other countries or other parts of the world, but I do know that in the United States, and particularly in my practice, depression and anxiety are so prevalent. I am amazed at how much this affects people. I mean, it's part of everybody's life, and it's something that definitely plays into LPR. So research has been done and actually shows that anxiety plays a pivotal role in lots of issues, but I found this pretty interesting. It's a risk factor for just a general lower quality of life and increased risk for all-cause mortality and cardiovascular disease. So put those on the spectrum of things that we're trying to deal with, and you can add in LPR and throat reflux in that as well. But I was just so shocked at how much I deal with this in my practice. I never realized it would be like this when I went to medical school. And even I'd say at the beginning of residency, I didn't quite understand how many people suffered with anxiety. So, the question might be asked, well, why are we talking about this as it relates to this masterclass? Well, really, it's because, so many people suffer with this kind of thing. And, a lot of times it is related to some sort of imbalance of neurochemical signals in the brain. And really up to this point, we've been limited in what we can offer patients. Basically boils down to, speaking with a therapist and doing some cognitive behavioral things versus medications. And one of the more common classes of medications, not the only, but one of the more common that people will get prescribed, is in a category called an SSRI, or a selective serotonin reuptake inhibitor medication. So those can definitely manage or modulate some of the neurochemical signals in the brain. But that's kind of it. And I summarized here, you either have to just talk it out or take medication. And that's hard because, medications have side effects. We've talked about proton pump inhibitors. Now we're introducing another category of medication that could definitely have some side effects. And so, really, what are patients left to do? They know that reflux and anxiety are connected. How do you break the cycle? What are we going to do? And I was happy to research and find out that exercise has become an amazing alternative for a lot of patients in treating anxiety. So here's what I love about it. It's free from side effects. I guess other than sore muscles, but helps to reduce blood pressure. It's got other physiologic benefits. Here's nice. You can schedule whenever you want. You don't necessarily have to make an appointment, schedule with a therapist. You may be able to do this in the comfort of your own home, or maybe at a gym or something like that. And it doesn't require, hopefully, a lot of time traveling to a location like it might in some smaller areas to get to a therapist or someone like that. We know that exercise can actually modulate some of the neurochemicals in our brain as well, including serotonin, which is one of the sort of, pleasure hormones for the body. This is that idea of sort of a runner's high. When you exercise, when you really, go for things like that, it can give you this feeling of accomplishment that some have suggested is like a high. And it also, we know, can help increase this idea of self-efficacy, basically proving to yourself that you're worth it, that you can do hard things. Nobody necessarily thinks day one running that they're going to be good at it, or be able to run a long distance, or even walk a long distance. And as you get better and better at these things, oftentimes you really build that personal accomplishment and self-efficacy, and you can do hard things. So there's an idea as far as why does exercise actually work to help reduce stress and anxiety? Well, it kind of gives us a chance to time out, take a break from what we're doing, stop thinking about the stress and the anxiety of life. And it really allows our brain to start thinking about something else. I know for me personally, it's hard to get the shoes on. It's hard to make the time to get out and go running or go down on the treadmill. But, once I'm down there or once I'm outside, there's just this sense of a release of whatever it was I was worried about. And I'm really focusing on the mental and physical stress of the exercise itself. And one of the instructors that I like to run with often talks about this, that it just kind of gives time to sort of sort through all of the chaos of the day, almost like you're running through the files of the day and trying to clear up some things and organize some things. And I found that to be true for myself. Sometimes I don't feel like I have time to exercise because I've got too much to do, but I actually find that when I take the time to exercise, I then become more effective and more focused on the things that really need to get done. And so I think this distraction technique and distraction theory is a real thing. As we exercise more, we actually feel better. So what does physical activity actually mean? If you're really going to start defining what we expect as patients start to exercise, what we're describing, and this comes from literature, this is the research speaking here, high intensity exercise is defined by a heart rate of 60 to 90% of your max heart rate. And that's what we really would want people to do. So you can Google these formulas. There's lots of different formulas, like 220 minus your age. There's some other, formulas that you can do, but basically you want to try and figure out what kind of these heart rate zones are for you. And then, most of us have some sort of smartwatch or a phone or something that can track our heart rate. And we would be able to then track and see what our actual percent of our max heart rate is. So we do know from the literature that high intensity is better than low intensity, but it has been shown in the studies that, even low intensity can help to reduce stress and anxiety. So it's best at high intensity, but don't sell yourself short starting off slow and low. You can get there, you'll build up to it. It's one of those things that we just got to get started somewhere, and you will see the benefits. Additionally, studies have shown that this has a really long-lasting effect. It's not like you exercise today and you feel good today. I mean, you can exercise and find that physical activity is lasting many months. Now, you'll want to continue to exercise, or maybe things won't necessarily continue to be, improvement for you as you go out. But the more you do, the better it works. But I am amazed at how much this seems to last in helping to manage anxiety and stress in patients. So it's a really good opportunity to get out and exercise. So here's a couple of suggestions as you start to move forward with this week's action plans. Exercise does need to be planned. If it's always hey, I'll do it, after I get this other thing done, or we've got too much to do, I can't really find a time. What I would suggest is that you plan it. You actually take your calendar, take your, whatever device you're using to manage sort of the things of your day, and really plan for it. Structured. I think that this is often difficult at first because we don't really know. I think a lot of people just start with walking because that's easy. Most of us know how to do that. And there's a lot of opportunities just to walk in our own neighborhoods or on our own treadmills and such. But then as you get better at it and you really want to do more, there are lots of opportunities to find online education about, certain exercise programs, training for a race, training for a half marathon. All of those things can be easily Googled, and you can follow a lot of free online modules that will help you to kind of find a structure. And again, it doesn't have to be that you're going to go run a marathon, but finding some sort of structure so that you can move forward with plans, I think is what we're trying to suggest here. Repetitive. This isn't I work out once every, few weeks. That's only going to lead to muscle fatigue. And every time you go, it's going to hurt. There is some truth to, as you do this repetitively, you're going to gain some stamina. It's going to be more fun, and you're going to find more pleasure in actually accomplishing goals and getting better at things. So all of this needs to be, with a good mindset that you're actually doing this to improve your overall health, improve your physical wellness, reduce stress and anxiety, help with LPR, whatever the motivation is. We need to have that motivation because that's what keeps us going and moves us forward. So planned, structured, repetitive with a good mindset. That's what we need in exercise. Okay, so in summary, exercise is an amazing alternative to medications in reducing stress and anxiety. We know it has a link to LPR and should help to reduce throat symptoms. It just generally helps in other wellness aspects of your life. And the more you do it, honestly, the better you feel. I'm a personal proponent of this, somebody who wasn't exercising much during all of my residency training, and now someone who exercises regularly. I feel so much better when I do, and I think it's a wonderful opportunity to help your throat. So, all right. that's the end of this lesson. Stay tuned. We got one more to go in this section. All right, week 4, lesson 3. Today we're going to talk about the importance of meditation. This whole module about trying to reduce stress and anxiety and helping people to kind of get through some of the mental side of LPR and throat reflux, and something really bothers people for sure. Again, I'm Morgan Yost. We're going to jump right into this lesson. Okay. So depression and anxiety are among the most common mental health conditions in the United States. We talked in the last module or last lesson about 33% of US adults suffer from anxiety. Definitely something that affects people throughout the world and country, but definitely seems to play into LPR. The number of people that I've talked to on Facebook, the number of people in my clinic that, really the underlying issue is often their anxiety is quite real. I was just recently kind of messaging back and forth with a lady on Facebook that I've become friends with through the reflux group that I'm a part of. And, I was kind of telling her about my modules and how I was trying to help people with throat reflux. And it was actually funny, unsolicited, she actually played right into this. She said, you know what? My reflux has really been pretty good lately. And she even said, I think it's because my anxiety's gotten better. And I kind of chuckled and I thought, that's so true. We focus so frequently on, some of the lifestyle changes like diet and exercise and weight loss and all that kind of stuff. But oftentimes the anxiety portion of things often gets overlooked. So that was really fun to kind of see her get better and know that it's really because of this lesson today. So how are we going to do that for you? What are some ways that we can help to reduce anxiety, again, without medications, without prescriptions, without expensive testing, and without necessarily, linking up with a therapist or someone to talk this out? Not saying that, that can happen or shouldn't happen in certain cases, but really the goal of this masterclass was to teach people how to reduce their throat symptoms and get a clear throat without expensive tests and without prescription medication. So to that end, this is my recommendation for you. So meditation is definitely something that is growing in both popularity. The research behind it to support it is growing, and it's really something that needs to be taken seriously now as a form of mental health training. So it's basically the opportunity to train your mind to calm itself. So, you've got to basically gain control over what your mind is thinking and reintroducing some of the positive things in your life and eliminating some of the stress and anxiety. So the goal is to achieve what we call a detached observation. So this idea that you basically separate yourself and get your emotions in a way that you can actually start to think and understand them and gain a different perspective. So we often kind of focus in on one side of all of our problems, and our anxieties feed into that. And a lot of times we can't really see a way forward or a different way of looking at that. And that's really what meditation is designed to do. It's that step back and that reset from a mental perspective. So mindfulness techniques, there's kind of this overarching just commentary of what are mindfulness techniques. There are lots of different ones, but basically the one that I'm really going to focus on is meditation. And so in looking through the research, studies have shown that mindfulness techniques are equivalent to taking medications for depression. So I think this fits nicely into the entire theme of this masterclass. We're trying to give you opportunities to help with LPR, stress, anxiety, poor sleep, all of those things, and eliminate medications with their potential harmful side effects and reduce the number of medication errors. So the effects of mindfulness techniques can actually last up to 27 weeks, according to one study. And as you continue to practice these things, it can prevent relapse into depression and anxiety cycles. So kind of the idea is it helps you get out of that problem, but also as you continue to practice these techniques, it can help you to stay out of those problems. And again, from everything I've read and all the research, there's no significant side effect that has been shown or described in the literature. Something that can, again, be done relatively easily, cheaply from home, and that fits with our masterclass. Okay, so where do you start? What I've been trying to do basically with all of these different classes and lessons is give you an opportunity for something that's probably already out there on the internet in the apps that's free. And so what I would recommend is something that I've used personally and I find to be very helpful is an app called Headspace. Again, I don't sell Headspace. I don't have any stock in Headspace. I don't do anything here other than use it personally myself. So it's an excellent app for those wanting to basically get started with meditation and mindfulness. And also, as a side note, it's a really great opportunity to track sleep. And so going back to some of our previous lessons and modules, if you're looking for an app that might be able to help with that, that's great too. A lot of, the smartwatches and things are doing that for us anyway. But what I love about Headspace is it assumes that essentially we're all new to this idea of meditation and we don't really know exactly where to start. So it has a balance of informational videos that you can watch, short little lessons about mindfulness, but then it also can help you to actually get started. So you basically log in, create an account, it helps you create a plan for what it is you want to do, and it will basically walk you through the entire process from the ground up in getting you into these mindfulness techniques. I know for me personally, meditation is very helpful at night. For me before bed in helping to sort of unwind for the day and help me to get better sleep and sort of allow my brain that opportunity to sort of reset both from a meditation perspective, but also from a sleep perspective. So Headspace is the one I would recommend. These come directly from Headspace, and these are some of their suggestions. First and foremost would be find a quiet place. You really want to have that opportunity free of distractions to get in a situation where you can find that time and that ability to really focus and get into a state of mindfulness. You want to turn off any distractions. So this is not a time to have the TV going in the background, finding a time when kids don't necessarily need you or whoever's demanding your time. You can take those, few minutes to really disconnect. Again, for me personally, that's that time after kids have gone to bed and I'm getting ready to go to sleep myself. So finding a quiet place, turning off the distractions. You might be asking yourself the question, okay, how much do I need to do this? Along this way, you've been asking me to do lots of things. We got to exercise. We got to watch what we're eating. We got to do all these different things. So how much is this really going to take? Well, Headspace is recommending 10 minutes 3 times a week. Minimal amounts, in my opinion, something that we all can do. You're talking, 30 minutes an entire week. That's less than most, TV shows that we're streaming. So broken up into 10 minutes, it seems to be a reasonable opportunity. And I love that on the Headspace app, they'll give you the suggestions, they'll walk you through the process and kind of help you do that. And you can even keep track of what you've done. And so I think it's really simple and straightforward. This is one of the more helpful apps I think that I can share with you. So in summary, here are your action steps as well. So anxiety is at the root of many conditions, including LPR. We talked about, poor quality of life, issues with just general overall mortality. Anxiety is a very common problem affecting many, many people, 33% of the United States, in fact. We know that medication is as good as meditation. There we go. Meditation is as good as medication. I got a little typo there on my slide for helping to reduce anxiety. I'd like you as your action step this week to download Headspace and do 10 minutes 3 times a week. And then additionally, check your RSI. Let's see if after these weeks of working on things, we've seen an adjustment in the reflux symptom index score. Okay, that's the end of today's lesson. Stay tuned for a little bit more. I think we got one more module to go. Okay, welcome to week 5. This is Morgan Yost. We're going to finish up with the last pillar from the American College of Lifestyle Medicine. Probably the shortest module, but I hate to say probably one of the more difficult modules for a lot of patients. I found particularly this one's a hard one. So for the American College of Lifestyle Medicine, they talk about avoiding risky substances, and this can encompass a lot of things. I'm going to really focus in just on 2 things that we know seems to make acid reflux and LPR worse. So here's a brief overview of week 5. We're going to talk about tobacco and alcohol. Those are the 2 major things from this pillar that we've got to address this week. So stay tuned. We're going to get that discussed. Okay, week 5, only one lesson this week. Again, probably one of the shortest things we'll talk about, but I do have to admit it's probably one of the more difficult things for patients, and one of the longer discussions that I have with patients as far as, why they really need to stop and how it's going to affect their throat. So again, this is Morgan Yost, week 5, lesson 1. We're going to talk about avoiding risky substances, including tobacco and alcohol as it relates to LPR. So let's get started. This is probably one of the biggest general lifestyle changes that I recommend for patients. And it's interesting because tobacco and alcohol can increase acid reflux and increase the acidity of the stomach. And so, it's one of those things that I think kind of, at least when I talk to patients, it's double-edged for them. There's this focus on how it affects LPR in their throat, but it's also just a general change that is often recommended by so many primary care providers and definitely by me as an ENT. And I hate to say, and we'll kind of discuss a little bit here, I do have to treat some of my acid reflux patients a little bit differently in the office when they come in with complaints, which we'll talk about a little bit, depending on whether or not they are a tobacco or alcohol user. Another problem with tobacco and alcohol as it relates to reflux is it may relax what we call the lower esophageal sphincter. So basically at the bottom of the esophagus, as you see from this little diagram, the bottom of the esophagus meets up with the stomach and it passes through a small little muscle here that we call the diaphragm. It actually happens to be the muscle that helps us to breathe. As the diaphragm moves up and down, it opens up the lungs basically and allows for oxygenation. But that diaphragm also serves as a physical barrier for acid to reflux up into the throat. So we think that some of these substances, tobacco and alcohol in particular, can relax that muscle and may unfortunately then lead to more acid reflux. So it's one of those things that we need to avoid for many different reasons, but particularly it can increase the acid of the stomach and also reduce the sphincter tone, thus leading to more likelihood of it coming up into the throat. Okay, this is what I mentioned a few moments ago. So let's say I've got a 65-year-old patient who comes in and he's got cough, hoarseness, feels like something's stuck in his throat. Honestly, I'm probably going to ask an RSI. If that RSI is significantly elevated, we're probably going to try reflux therapy. We're going to talk about various options that they have. And many times I'm going to say, all right, let's see you back in a couple of months and see how things are going, and expect to see a reduction in their symptoms and hopefully reduction in their RSI. And hey, they're a happy patient. Let's say that same 65-year-old person comes in with the exact same concerns, cough, hoarseness, feeling like there's something stuck in their throat, except in their history, I've been smoking since I was in my 20s. So 45 years of smoking potentially. Well, instantly, the hairs on the back of my neck prickle and stick up, and I say, we really got to look into this, and there may be a higher likelihood that you have cancer, in fact. And that's a discussion that I have with a lot of my patients. And that's what I meant when I said, I have to treat them a little bit differently. My index of suspicion, my concern, what I think could be going on still might be LPR, but I have to rule out something more scary, something like laryngeal cancer or carcinoma. So those patients on the first visit don't just get lifestyle modifications for reflux. They don't just get medications. They get a flexible laryngoscopy, a scope to take a look into the larynx and see if there is by chance some sort of lesion that could be explaining their cough, their hoarseness, or feeling like there's something stuck in the throat that isn't LPR. Okay, this conversation I have a lot. The patient comes in and says, yeah, I have been smoking since I was in my 20s. I'm 65 now. And I'll often ask the question, do you have any intent to quit? Do you want to quit? Is this something that's even on your radar? And a lot of patients kind of, shrug their shoulders and look at me. And basically, I think what they're saying in their head is, I'm not going to quit. It's too late. I've already smoked too long, or I don't want to, or whatever. And the conversation I always have with them is two things. First, I always say, look, it's never too late to quit. There are always benefits for quitting, not just in LPR, but in all sorts of other problems and issues generally related to health. So quitting will increase overall health. We know that. It can improve, obviously, the reflux control that we've talked about, and there could be a significant reduction in anxiety related to throat cancer. I'm amazed at the number of people on the Facebook groups and patients I've talked to in the past that they're so anxious that they have throat cancer that, when I even introduce the idea that this could be just LPR or acid reflux, we rule out anything scary. They don't have a tobacco history. Their anxiety instantly just improves. So that's one of the first things I always tell them is it's never too late to quit. There's always an opportunity, and it's better now than never. The other thing that I always talk to them about, just trying to be empathetic and understand that, I have never smoked. I've never done it. I don't know what it's like. I often say to them, look, I've never quit smoking before, so I can't necessarily tell you that I know what you're going through. But I have seen many patients successfully quit. I've seen people who have smoked for many decades, and for whatever reason, something changes in their life and they're able to do it. I can't necessarily explain exactly how they've done it. I know there's lots of resources out there for them, but ultimately the number of people that, went from smoking a pack of cigarettes a day to stopping the next day because guess what? I had to tell them they had throat cancer. It's been pretty amazing how motivated they are at that point to say, okay, I got throat cancer. Now it's time to quit. Well, what I try and encourage patients who maybe I don't have to get the diagnosis of cancer, but I can tell them, look, we can avoid that. If you stop now, it's never too late. And there's always, room for improvement and benefit from quitting. Let's try and stop now before we have to have that discussion about throat cancer in the future. So again, I've never smoked. I don't know what it's like to quit, but I can imagine that it's one of the more difficult things that patients have ever had to do. But I do want to give my assurance and my confidence that people can quit. People have quit. There's more resources out there to stop smoking than there's ever been in the past. And it's something that can be done. Okay, let's transition a little bit to alcohol and wine. So we know that alcohol and wine have a very high acidity, and so this could be making things much worse. We are putting acid on top of an acidic environment. We know about irritating the throat lining related to pepsin. So we're basically fueling the fire at this point. A lot of patients that I kind of had this discussion with, they'll often say, no way, I can't do that. I'm never going to quit that. And what I often say to them is, well, this is something you could stop maybe for a period of time. Give this a few weeks, give this a few months, potentially give your throat a chance to heal. And then once things have healed, there's an opportunity to maybe slowly reintroduce a small amount, infrequent, something to that effect. A lot of times when I first throw the lifestyle modifications to patients as a treatment option, they'll instantly say, oh, I can't do that. And I say to them, well, okay, maybe we don't have to do this forever. Maybe this is something that we stop for a while. We let the throat heal, and then we introduce one item at a time, maybe something that you're missing in particular, and then see how you do. Sometimes the symptoms flare right back up and you say, wow, every time I have a glass of wine, my throat feels worse. I decide not to have that anymore. Maybe I have a glass of wine once a week and it's no big deal. Maybe a spicy meal, not a big deal. Maybe, I have a spicy meal. It's the worst thing ever, and I'm just not willing to sacrifice for that. So that's a really great opportunity to encourage patients that these aren't forever. These are just an opportunity until things get better, and then we start to reintroduce them. That particularly has been helpful as we've discussed elimination of alcohol for patients. Okay, so that's the end of this lesson on risky substances. Again, very short lesson, not a lot to discuss as far as topics and items. But again, I do think some of the more difficult things for patients to really start making changes. So I encourage you to really consider stopping tobacco if you do smoke, also using smokeless tobacco, and definitely stopping alcohol. Again, not potentially forever, but for a long enough period of time that we can give your throat to heal. So that is the end of our lesson today. Okay, week 5, lesson 2. We've titled this one Tying It All Together. This is a chance to summarize, recap, encourage, and also give you kind of what we think will be the next steps for you. So let's jump into that really quick. All right, so you've taken the first step. We have taken a lot of time over the last few weeks to really walk you through LPR and reflux, silent reflux, all the things that we've talked about. We've hopefully given you some really significant framework and foundation for how you're going to get feeling better. Over the decades that I've been treating patients with LPR, I'm amazed at how much people suffer with this, and it can range. It can be patients who, they have significant LPR on, say, a reflux symptom index score, but they don't necessarily report that it's really affecting them. And then I can have people who have, RSIs that are actually quite low, and the amount of emotional, strain and stress that they're feeling over this diagnosis is quite severe. So that's what's kind of interesting about it. And my hope for you is that by learning some of these techniques, we can help to kind of minimize those symptoms, make it more into hopefully that first situation where even if you do have occasional episodes of reflux, it's not something that you're necessarily suffering with. And we've made this a much more manageable process for you. Okay, so the key to overcoming reflux is really recognizing the symptoms for what they are. My goal in creating this masterclass was just to give people information and let them know that LPR is super common, and so many of the problems they're having are really boiled down to inflammation in the throat. It inflames the entire mucosal layers of the ears, nose, and throat, explaining why we have eustachian tube issues, pain and pressure in the ears, nasal congestion, postnasal drainage, cough, globus sensation in the throat, this fear of, some sort of mass or tumor or something stuck in the throat. All of this can very quickly and easily be explained by LPR, but it's a diagnosis that not a lot of people are familiar with. And so, goal one of the masterclass is just to educate and help people recognize a little bit more on what this really is. The journey is to get a clear throat, and I hope that over 6 weeks, we've been able to accomplish that. Some of you may have progressed through this relatively quickly. Maybe you found some of the steps easy to work with and easy to do. Some of you, honestly, it may be something where you go through the class once and then, hey, start over and re-examine some of the ones that are maybe more of a problem. I've treated thousands of patients with LPR. I've seen great success stories, people who've suffered for years who have felt wonderful after, treating their throat this way. I unfortunately see a lot of people who kind of do a little bit of a yo-yo, where roller coaster, kind of up and down days, up and down weeks, times when they're more diligent about lifestyle changes, times when they're not. And hopefully what the masterclass has also been able to do is give you a chance to reevaluate and refocus when maybe things aren't quite so good. So here's a review basically of the modules and some of the action steps that we asked you to take. So module 1, it was just basically the education about LPR and really establishing that framework of the American College of Lifestyle Medicine and the 6 pillars. In module 2, it was all about nutrition and encouraging you to start using MyFitnessPal. Would encourage you to revisit that again if you're not continuing with that, addressing calorie counting, fitness and activities, things like that. MyFitnessPal is a great option for people. Module 3 was all about physical activity and hoping that you would download and start using Strava, finding accountability partners, somebody that can help to motivate you to get out and exercise, starting slow if that's where you're at, but ultimately, getting more and more activity and getting more and more time outside. And I think that's going to help a lot. Next was sleep and stress, using the Headspace app. Meditation, we know, is wonderful for helping to reduce stress and anxiety, and also the importance of sleep. And hopefully I've been able to show you that in the masterclass, that really it's sleep that's one of our main treatment modules for helping people to just generally feel better. The last module was about risky substances. Again, probably one of the more difficult things to do, but one of the more simple and more straightforward modules that we talked about, avoiding tobacco and alcohol. And along this whole process, I hope that you've taken your RSI and been able to track that over 4 to 6 weeks. I do expect to see a reduction in the RSI sometime around 4 to 6 weeks. We were hoping that you would be seeing yourself exercising 3 to 5 times per week using the Strava app, and meditating 10 minutes 3 times a week using the Headspace app. So those are the reviews of the modules and also the key action steps that we hope you've taken. So I do also want to take this moment to encourage the community. There's a chance for you to get online, meet up with like-minded people in a very positive environment. I know some of the groups that I've been a part of on Facebook and other social media apps are pretty frustrating sometimes, quite negative. A lot of people who get on there and really rant a lot, not a lot of support, not a lot of positivity. So I'm hopeful that in the community, we can do that for you. I will be available in there to continue this process, maybe some one-on-one time, some coaching calls, definitely messaging. And for those that I've already messaged through Facebook, you'll know that I try and be as responsive as I can be and try and give you as much information and positivity as I can. So I would encourage you to get on the community. There'll be some things that we'll ask you to do in the community, as far as introducing yourself, telling a little bit about your story, maybe sharing your RSI, so that we can start to get an idea of kind of where everybody's at. And then hopefully we can support each other along the way as we start to see those symptoms and that RSI go down. So that wraps things up for us. I really want to thank you for being a part of this masterclass. I'm just honored, to be able to take part in this hopeful journey for you in education and support, and hopefully feeling better. And I really want to thank you and appreciate your support of me and confidence in helping you to get a clear throat in 6 weeks. Thank you.